When you look around, ask yourself the following question. Is there danger for you or the ill or injured person? Move an injured person only if they are in danger or if you need to move them to safely provide first aid or CPR. Should you move an ill or injured person? Most of the time, no. This is especially important if you suspect that the person may have a pelvic or spine injury because moving them could worsen the injury. However, in certain situations, you may need to move a person for safety reasons or to provide first aid effectively. You should do this only when the current area is unsafe for you or the ill or injured person, or it is unsuitable to provide first aid. For example, if there is a fire, you need to get yourself and the person to a safe location. Also, some emergencies may happen in confined spaces, like a car, and you may need more space to provide effective first aid. If you do need to move someone, here's one way to do it. Drag the person by their clothes. Place your hands on the person's shoulders, grab their clothes, and pull them to safety. Are others around to help? If so, have someone phone 911 and get a first aid kit and AED if one is available. If no one else is near, phone 911 yourself and put your cell phone on speaker mode if available. Be prepared to provide information to the 911 dispatcher about who is ill or injured, how many people are hurt and what happened, and your location and how to get there. If there are other bystanders, send one of them to meet the paramedics and lead them to the scene. As you assess the need for first aid, it's important to know when and how to phone for help. As a general rule, you should phone 911 and ask for help whenever someone is seriously ill or injured or you're not sure what to do in an emergency. Here are some examples. The person doesn't respond to voice or touch, has chest discomfort, signaling possible heart attack, has signs of stroke, has a problem breathing, has a severe injury or burn, has severe bleeding, has a seizure, suddenly can't move a part of the body, has received an electrical shock, or has been exposed to poison. You will learn more about the signs and first aid actions for these medical and injury emergencies later in the course. When you look around, ask yourself the following question. Is there danger for you or the ill or injured person? Move an injured person only if they are in danger or if you need to move them to safely provide first aid or CPR. Should you move an ill or injured person? Most of the time, no. This is especially important if you suspect that the person may have a pelvic or spine injury because moving them could worsen the injury. However, in certain situations, you may need to move a person for safety reasons or to provide first aid effectively. You should do this only when the current area is unsafe for you or the ill or injured person, or it is unsuitable to provide first aid. For example, if there is a fire, you need to get yourself and the person to a safe location. Also, some emergencies may happen in confined spaces, like a car, and you may need more space to provide effective first aid. If you do need to move someone, here's one way to do it. Drag the person by their clothes. Place your hands on the person's shoulders, grab their clothes, and pull them to safety. Are others around to help? If so, have someone phone 911 and get a first aid kit and AED if one is available. If no one else is near, phone 911 yourself and put your cell phone on speaker mode if available. Be prepared to provide information to the 911 dispatcher about who is ill or injured, how many people are hurt and what happened, and your location and how to get there. If there are other bystanders, send one of them to meet the paramedics and lead them to the scene. As you assess the need for first aid, it's important to know when and how to phone for help. As a general rule, you should phone 911 and ask for help whenever someone is seriously ill or injured or you're not sure what to do in an emergency. Here are some examples. The person doesn't respond to voice or touch, has chest discomfort, signaling possible heart attack, has signs of stroke, has a problem breathing, has a severe injury or burn, has severe bleeding, has a seizure, suddenly can't move a part of the body, has received an electrical shock, or has been exposed to poison. You will learn more about the signs and first aid actions for these medical and injury emergencies later in the course. But when an emergency happens, what do you do if you're alone? Shout for help. If no one answers and the person needs immediate care and you have a cell phone, phone 911 and put the phone on speaker mode. The emergency dispatcher could provide further instruction and tell you how to give first aid, provide CPR, and use an AED. Or, if you're with others during an emergency, one of you can start assessing the need for first aid while the other phones 911. When you're on the phone with the dispatcher, don't hang up until the dispatcher tells you to. Answering all the dispatcher's questions won't delay the arrival of help. And be aware of your surroundings. Knowing the address of your location will help emergency responders reach you more quickly. It's also important for you to know how to phone for help from your location. Do you know how to activate the emergency response number in your workplace? For example, is it necessary to dial 9 for an outside line, or is there an internal number to phone that will notify responders that are on site? For the purpose of this course, we will say phone 911 as the emergency response number. The video will now pause for you to write down the emergency response number for your location in your student workbook. As you assess the scene for safety, there are universal precautions you should take. These precautions are called universal because you should treat all blood and other body fluids as if they contain germs that can cause disease. Your first aid kit should include personal protective equipment, or PPE, such as eye protection and medical gloves. While you are giving first aid, PPE keeps you safe from blood and other bodily fluids, such as saliva and urine. Additionally, eye protection can help shield you from chemicals or poisons that may be nearby. First aid kits may also contain a pocket mask for giving breaths in case you need to provide CPR. And because some people are allergic to latex or have developed sensitivity to latex that can cause serious reactions, you should use non-latex gloves if at all possible. As a reminder, if you are in charge of the first aid kit, remember to keep it stocked with all of these items and the additional items listed in your student workbook, and to restock after any of the supplies are used. While the AHA always recommends the use of PPE, and this course will often show PPE being used, it's possible you may find yourself in an emergency where PPE is unavailable. In this situation, use your best judgment for how to render first aid. You should always wear PPE whenever there is visible blood or other body fluids. However, if the person's blood does make contact with your skin or splashes in your eyes or mouth, take these steps. Remove your gloves if you are wearing them. Immediately wash your hands and rinse the contact area with soap and lots of water for 20 seconds. Rinse your eyes, your nose, or the inside of your mouth with plenty of water if body fluids splattered in any of these areas. And report to a healthcare provider as soon as possible. Most of us have worn some type of glove in our lifetime, and you probably remove them without much thought. However, because of the high probability that gloves worn while providing first aid have been exposed to bodily fluids, the risk of infection is significantly higher than in other situations. For this reason, using protective gloves and taking them off correctly are important steps when it comes to your safety and the safety of others. While wearing gloves helps to protect you from exposure to body fluids, improperly removing them can impact the protective effects and expose you to germs and disease. Let's watch how to remove protective gloves. First, grip one glove on the outside near the cuff and peel it down until it comes off inside out. Cup it with your other gloved hand. Next, place 2 fingers of your bare hand inside the cuff of the glove that is still on your other hand. Peel that glove off so that it comes off inside out with the first glove inside it. If blood or other body fluids are on the gloves, dispose of the gloves properly. Put them in a biohazard waste bag if available. If you do not have a biohazard waste bag, put the gloves in a plastic bag that can be sealed before you dispose of it. Always dispose of protective gloves properly so that anyone who comes in contact with the waste bag does not get exposed to blood or other body fluids. You should always wash your hands after removing gloves, just in case some blood or body fluids came in contact with your hands. To wash your hands properly, wet them with clean running water, warm if available, and apply soap. Rub your hands together and scrub all over for at least 20 seconds. Then, rinse your hands with lots of running water. Dry your hands using a paper towel or air dryer. If possible, use your paper towel to turn off the faucet. If you can't wash your hands right away, use a waterless hand sanitizer containing at least 60% alcohol. Rub your hands together for at least 20 seconds or until the sanitizer covers the tops and bottoms of both hands and all fingers, whichever is longer. Then, let the remaining sanitizer air dry. As soon as you can, wash your hands with soap and water. Washing your hands well is one of the most important protections you have against infection. While you learned hand washing today because of the possible exposure to body fluids while providing first aid skills, properly washing your hands is one of the best ways to protect you from germs in your everyday life. Washing your hands often and not touching your face is one of the best things you can do for your health and the health of those around you. We've talked about assessing the scene to be sure it's safe and taking precautions, such as wearing PPE. Next, you must assess the ill or injured person to find out what the problem is before you give first aid. Let's look at the steps. First, make sure the scene is safe. As you approach, look for what could be causing the problem. Next, check to see if the person responds. Approach the person, tap them, and shout,
"Are you okay? Are you okay?"
If the person doesn't respond and you are alone and have a cell phone, phone 911 and put your phone on speaker mode. Otherwise, send someone else to phone 911 and get the first aid kit and the AED. Check to see if the person is breathing. If the person isn't breathing normally or is only gasping, begin CPR. If the person is responsive, ask them what the problem is. A person may only be able to move, moan, or groan when you tap them and shout. If so, phone or send someone to phone 911 and get the first aid kit and AED. If the person is responsive but can't tell you what the problem is, look for any obvious signs of injury, such as bleeding, broken bones, burns, or bites. If you see any of these obvious signs, you'll need to render first aid. Finally, if the person is breathing but not responsive and you see no obvious signs of injury, look for any medical information jewelry. This jewelry tells you if the person has a serious medical condition. Common examples are diabetes and epilepsy. As we wrap up first aid basics, it's important for you to know that you may learn private things about the person you are helping. Keep private information private. Share information about an ill or injured person only with emergency responders when they take over. Allergies are quite common, but a severe allergic reaction can quickly turn into a medical emergency. Symptoms of a mild allergic reaction are stuffy nose, sneezing, itching around the eyes, itchy skin, or a rash. However, some reactions that seem mild at first can become severe within minutes. A number of things can cause a severe allergic reaction, including eggs, peanuts, chocolate, some medications, and insect bites and stings, especially bee stings. The signs of a severe allergic reaction are trouble breathing, swelling of the tongue and face, and signs of shock. An epinephrine autoinjector is a prescribed device that has a dose of medicine in it. The autoinjector will help a person with a severe allergic reaction breathe more easily. If a person has an epinephrine autoinjector, they will generally know how and when to use it. If the person needs help administering an epinephrine injection for which they have a prescription, Good Samaritan laws allow for you to help, providing you act in good faith. Now, let's watch a demonstration of a person administering an epinephrine injection to someone else. First, make sure the scene is safe. Phone or send someone to phone 911 and get the first aid kit and the AED. To use the epinephrine pen, follow the instructions on the pen and make sure you are holding the pen correctly. Hold the pen in your fist without touching either end because the needle comes out of one end. Press the tip of the injector hard against the side of the person's thigh, about halfway between the hip and the knee. Give the injection through clothes or on bare skin. The leg should remain still while the needle is in place. Pull the pen straight out, making sure you don't put your fingers over the end that has been pressed against the person's thigh. Either the person getting the injection or the person giving the injection should rub the injection spot for about 10 seconds. Note the time of the injection and give the pen to paramedics for proper disposal. If the person doesn't get better and there is a delay of greater than 5 to 10 minutes for advanced help to arrive, consider giving a second dose if available. In the United States, someone has a heart attack about every 40 seconds. Many people don't want to believe they are having a heart attack. They think their symptoms are not serious, or they don't want to bother anyone with symptoms that they dismiss as minor. Some heart attack symptoms may feel like acid reflux or indigestion, but they're not the same thing. This is especially common for women who may mistake a heart attack for normal aging or the flu. It's important to be aware of the signs and symptoms of a heart attack because the sooner it's treated, the less damage there is to the heart. If you suspect someone is having a heart attack, you must act and phone 911 right away, even if the person doesn't want you to. One of the main signs of a heart attack is chest discomfort. Most heart attacks involve discomfort in the center of the chest that lasts more than a few minutes or that goes away and comes back. It can feel like uncomfortable pressure, squeezing, fullness, or pain. Discomfort may also appear in other areas of the upper body. Symptoms can include pain or discomfort in one or both arms, the back, neck, jaw, or stomach. Other signs of a heart attack include shortness of breath with or without chest discomfort, breaking out in a cold sweat, nausea, or lightheadedness. But what about the difference between a heart attack and cardiac arrest? We often hear these two terms used as if they're the same, but they're not. When a person is in cardiac arrest, they need CPR immediately. When a person has a heart attack, their heart is still beating and they need a different kind of help. If someone has signs of a possible heart attack, do the following. Make sure the person stays calm and rests. Phone 911 first so that help can arrive quickly. Ask someone to get the first aid kit and an AED. Once the first aid kit arrives, if the person has no allergy to aspirin, no serious bleeding, and no signs of a stroke, have the person chew and swallow 1 adult or 2 low-dose aspirins. If the person becomes unresponsive, be prepared to provide CPR and use the AED. Remember that during a heart attack, giving aspirin appropriately can make a big difference in the person's quality of recovery. Strokes occur when blood stops flowing to a part of the brain. This can happen if a blood vessel in the brain is blocked or leaks. Many people can be given treatments in the first hours after a stroke that can reduce the damage and improve recovery. Therefore, it's important to recognize the signs of stroke quickly and get medical care fast. You can use the FAST acronym to recognize the warning signs of stroke. It's a simple way to remember these warning signs of stroke, which can occur suddenly. Face drooping. Does one side of the face droop or is it numb? Arm weakness. Is one arm weak or numb? Speech difficulty. Is speech slurred? Is a person unable to speak or hard to understand? Time. If any of these symptoms are present, it's time to phone 911. Additional symptoms of stroke include sudden confusion, sudden trouble seeing in one or both eyes, sudden trouble walking, loss of balance or coordination, and sudden severe headache with no known cause. If you see even one of these signs, and even if symptoms go away, take these actions. Phone or have someone phone 911 and get the first aid kit and AED. Note what time the stroke signs first appeared. Remain with the person until someone with advanced training arrives and takes over. If the person becomes unresponsive and is not breathing normally or only gasping, provide CPR. In this part of the course, you'll learn about external bleeding. According to the U.S. Bureau of Labor Statistics, a non-fatal workplace injury or illness occurs every 11 seconds. Workplace injuries can often result in external bleeding. Most bleeding is minor and can be treated without advanced help. Getting the first aid kit is an important step to control bleeding quickly, because it will contain the dressings, bandages, gloves, and manufactured tourniquet you may need to render first aid. It's important to stay calm, as bleeding often looks worse than it is, and most bleeding can be stopped with pressure. With all bleeding injuries, your first action should be to identify 2 factors to guide your care. 1. The amount of bleeding, and 2. The location of the bleeding. Minor bleeding occurs from small cuts or scrapes and is easily controlled often with a simple adhesive bandage. For minor cuts anywhere on the body, wash the area with soap and water, and then apply a dressing to the wound. Once the bleeding has stopped, you can apply an antibiotic ointment if the person has no known allergies and an adhesive bandage. This method has been proven to help wounds heal faster and more effectively. For more severe wounds, it may be necessary to use bandages, dressings, or a manufactured tourniquet. A dressing is a clean material used directly on a wound to stop bleeding. If you do not have a first aid kit, or your kit does not contain gauze dressings, you can use any other clean piece of cloth. A bandage is material used to protect or cover an injured body part. A bandage may also be used to help keep pressure on a wound. If necessary, you can hold gauze dressings in place over a wound with a bandage. A manufactured tourniquet should also be included in your first aid kit. They come in several different styles, so you should become familiar with what your kit includes. If the wound is bleeding more than can easily be stopped with an adhesive bandage, you will need to determine whether it is non-life-threatening or life-threatening bleeding. Consider a wound to be life-threatening if the flow of blood is continuous and steady, and if the volume of loss appears large, about equal to half of a 12-ounce can. You do not want to wait for blood to accumulate to take action, as cuts that may seem more moderate at first can become severe if the person is on certain types of blood-thinning medications, like aspirin. It is important to not underestimate the amount of blood loss and be prepared to take action. With any bleeding, these are the steps you should take. First, make sure the scene is safe. Be sure you and the injured person are safe from whatever caused the bleeding. Then, send someone to get the first aid kit. If possible, have the person apply direct pressure to the injury while you are quickly gathering supplies. Put on gloves as soon as they are available. If the bleeding is non-life-threatening, apply a dressing to the bleeding area. Put direct pressure on the dressings using the heel of one hand, with the other hand stacked on top of the first. If possible, keep your arms straight while applying pressure downward onto the wound. Direct pressure should be firm, steady, and constant. Do not remove pressure from the wound to add more dressings. Also, do not remove a dressing once it's in place, because this could cause the wound to bleed more. Continue holding firm pressure until help arrives or the bleeding stops. Releasing pressure too soon can allow the wound to start bleeding again. If the bleeding does not stop, press harder. Keep pressure on the wound until it stops bleeding. Once the bleeding stops, or if you cannot keep pressure on the wound, wrap a bandage firmly over the dressings to hold them in place. A person with bleeding should be seen by a healthcare provider as soon as possible, because the person may need stitches or a tetanus shot. You've just learned the steps for providing first aid for non-life-threatening bleeding. But what if the injury is more severe? Life-threatening bleeding can occur from a variety of traumatic injuries, like car accidents, cuts from glass, accidents involving saws or other tools, knife penetration injuries, gunshot wounds, or falls from a height. You should always phone 911 first when there is life-threatening bleeding. If the person has life-threatening bleeding on an extremity, like an arm or leg, you will need to use a tourniquet. The first aid kit may contain a pre-made or manufactured tourniquet. If it does not, we recommend adding it to your kit, especially if your workplace meets the requirements of Class B locations. There are different types of manufactured tourniquets. For the purposes of this course, let's look at how to apply a windlass rod-style manufactured tourniquet. First, apply the tourniquet 2 to 3 inches above the bleeding site on the person's arm or leg, closer to the heart. Do not place the tourniquet on a joint, such as a knee or elbow. Go above the joint if necessary. Next, pull the free end of the tourniquet to make it as tight as possible and then secure. Then, twist the windlass or knob until bleeding stops. You need to twist the windlass as tight as possible to stop life-threatening bleeding. Tightening will often cause pain, but it will minimize blood loss. Finally, secure the windlass and note the time the tourniquet was applied. If a manufactured tourniquet is not available and direct manual pressure with or without the use of a hemostatic dressing does not stop life-threatening bleeding, a first aid provider trained in the use of an improvised tourniquet may consider using one. If the person continues to bleed after you have applied a manufactured tourniquet, apply a second manufactured tourniquet above the first, closer to the heart. If they continue to bleed or a second tourniquet is not available, pack the wound and apply pressure as follows. If the bleeding is life-threatening and is located on a body part that is not the arm or leg, like the head, neck, chest, or abdomen, you should pack a wound and then apply pressure. Packing can also be done if the tourniquet does not stop the bleeding in the arms and legs. Packing the wound means taking a material like gauze or clean cloth and placing it tightly into the wound. Continue to apply direct pressure until the bleeding stops. Stop the Bleed is a national awareness campaign and call to action that encourages bystanders to become trained, equipped, and empowered to stop or reduce severe bleeding before professional help arrives. The AHA supports raising awareness about Stop the Bleed's efforts to minimize injury and death caused by blood loss. If you're interested in more information on this campaign, including additional resources, visit stopthebleed.usuhs.edu. You have just completed the AHA Heart Saver First Aid course. The knowledge you gain today can help you change or even save someone's life. If you practice your skills often to keep them up to date, you'll have the best chance to help an ill or injured person. It all starts with you. At the AHA, we remain committed to exceptional training. Go to heart.org/CPR for more information on our courses and to learn more about our mission. Congratulations on behalf of the American Heart Association. Thank you for taking time to attend this important course.